year in the United States, more than 26,260 Americans aged 25 to 64 die to the lack of affordable health care. That is more than 2 times the number of students that are currently enrolled at this university. In recent surveys done, 1 in 4 families have rejected medical care due to the cost. Now imagine a world where none of these families had to worry about the cost. That is a world with universal health care. I have spent a considerable amount of time researching the topic in order to remain factual. I, along with many others I know, have firsthand experience in people not being able to afford health care. During this speech, keep in mind how you and your family members are affected by the cost of health care and health insurance. Private healthcare systems like the one in America are not ideal for low-income families. Health insurance is not affordable for low-income households. In 2024, Employer Health Benefits did a survey, and the average cost for a single coverage insurance plan is $8,951, while a family coverage plan is $25,572. For a basic insurance plan, that is expensive, even for the average American family. Health insurance is also dependent on money. A private healthcare system is set up to where the amount of money a single American or the business that they work at makes depicts how much coverage you get by health insurance. Which means that lower income jobs or Americans cannot afford it or get less coverage. In the book Universal Healthcare, Claudio Butis writes about people in the United States being scared to lose a job because they're afraid of losing insurance for themselves or a family member. If there was a universal healthcare system, low-income families wouldn't have to worry about losing insurance or not being able to afford it. Now that I've established the difficulties of health insurance, I'm going to talk about what life is like without insurance. The healthcare system in the United States is expensive. Prices of healthcare are high, especially today. There's a lack of price transparency in healthcare in America, and a lot of times patients will go into a procedure or getting an x-ray done without even actually knowing the price. When interviewing a friend who works at Shannon Hospital here in San Angelo, he stated that a lot of the times the doctors won't even know how much a procedure will cost a patient until after it's done. Without insurance, the price of primary care visits in Texas is $150 to $300. An emergency room visit can cost between $1,500 to $3,000. That is a big amount of money for people who are low income. Even for families who are not low income, that's a big amount of money to pay out of pocket. The price of healthcare is leaving people in debt. According to Claudio Butis, author of book United Healthcare, at least 1/4 of Americans report having problems paying medical bills. For low-income families, it's hard paying medical bills because there's a lack of money. A lot of said low-income families live paycheck to paycheck, and it's hard to put aside money to pay for medical bills when you don't even have enough to live. If there was universal health care, they would save money because they wouldn't have to worry about health insurance or the price of basic medical attention that they need. And they would be able to not go bankrupt by paying said medical bills. Ultimately, I believe that every citizen of the United States deserves to have affordable and access to affordable health care. Which is why that we, as U.S. citizens, should really push to get a universal healthcare system, because it would not only benefit low income, but every American. We wouldn't have to pay for health insurance. We wouldn't have to worry about paying medical bills or going into debt because of medical bills. The loss of U.S. citizens due to the lack of affordable health care is unethical. Once again, I have spent hours on researching this topic and forming my opinion based on facts. Hopefully in the years to come, the number of Americans dying each year due to being uninsured or not being able to afford health care can change, and we can become a healthier country.